What happens after the blood cancer has been diagnosed? We will go to the treatment option. Mostly all cancer are chemotherapy based regime. What I mean by that is radiation or surgery is not required in blood cancer. Unlike solid organ cancer, we do not grade cancer like grade 2, grade 3, grade 4. Blood cancer, because blood is there in everywhere in the body, it is the second largest organ besides the skin, we grade it like standard risk, intermediate risk and high risk. Irrespective of whatever grade is, mostly blood cancers do very well, that is 80 to 90% of cure rates in almost all type of risk factors. Now, the rule of this 80 to 90% good curable rate is early diagnosis. You do not have to waste any time once there is a suspicious of blood cancer. We will have to be very prompt in diagnosing it and very aggressive in treating it. So, treatment modalities come as a chemotherapy protocol, which means there will be tablet and there will be IV injections given to you in a treatment chemotherapy protocol. It varies over 1, 2, 3, 4 cycle and then the maintenance cycle. When you have completed the cycle and then the bone marrow test will be repeated just to see if you are in remission. Remission means all your cancer cells are not there, it is in a very negligible amount. And once you have the remission, we will go further with the planned chemotherapy. If the remission is not achieved, we go for the higher intensive dose of chemotherapy. Now, all blood cancer do not require a transplant option, but if you are a refractory, means you are not responding to any of the treatment plan suggested, in that case the transplant option will be given. Or you are a relapse, once you are cured and the disease comes back, in that cases the bone marrow transplant is given as a treatment modality. Now, coming to the side effects or the myths of which includes blood cancers are, the first thing which people ask us is, will the hair come back? Yes, all the things which are caused by chemotherapy, once the chemotherapy is stopped, all these things will be coming back to normal slowly. Is it a very costly affair? No, it is not a very costly affair, but if you are from a very low socio-economic background, there are multiple agencies like NGOs, government help, there are a lot of government skill can help you to cure the blood cancer and go through the treatment. There are a lot of medical facilities available for chemotherapy drugs, you just need to approach a medical social worker for all this. And coming to the last line which I will conclude is, if you are suspicious, if you have been told regarding blood cancer, do not delay the treatment in the confusion, because early diagnosis and early treatment are the better prognosis rate. Thank you.